Good morning, everybody. Hope you're doing well. We've come to the end of the week now, and I was just reflecting on the week gone by, and a couple of patients have really stuck in my mind. I just wanted to kind of share that with you. So one is a lady who I have been seeing over the last year or so about various other issues, and now thinking about it, those were probably related to what she revealed to me this week. So one of them, especially something that we went into depth this week, was about these headaches that she had been experiencing. It described as very tight kind of feeling across her forehead, and also like tight band-like feeling, like her head is in a vice or someone squeezing her head. Very typically, these are features of what we call tension headache. It's kind of when all the muscles get tight, and the root cause, underlying cause, more often than not, is something which is causing stress in your life. Something is stressing you out, causing you a problem, causing you to worry. Something's on your mind a lot of the time. That could be in your work life, your home life, or any other avenue of life. But often we don't realize that those things can start to cause physical symptoms, and a very common one of which is headache, like a tension headache. So as I said, look, I've been seeing her for a few times over the last 12 months for various other slightly vague symptoms. And we had touched upon this before as well. But she'd always kind of said, look, everything's fine, home life is great. But this week, something kind of switched in our doctor-patient relationship, and whether she suddenly felt a level of trust with me, because we've been seeing each other for a year now. And she really opened up about the problems that she has been experiencing in her life. And once we kind of got to that stage, everything started to kind of make sense and fall together. The symptoms she'd been experiencing over the last 1 year, and certainly about these tension headaches that she was having as well. So look, we obviously spoke about medication and so forth, but one thing I had to really emphasize to her was medication will only get us so far. What's really important, or what will be important, is to address that root cause of stress or problem in her life, which actually is causing these physical symptoms. So I guess there were two big take-home messages for me and for you there. Number one, it takes time for that doctor-patient relationship to build up, and that trust for people to really open up to us. I'm glad that she did this week, so we could kind of talk about that. And I have no doubt that she felt better, and maybe a bit more clarity after we had that consultation this week. Second of all, is that yes, stress, problems, anxiety, they can cause physical symptoms as well, and a very common one of which is tension headache, which is typically that kind of tight headache feeling across the front of your forehead, or like a tight band-like feeling around your head. Of course, there are many other more serious causes of headaches. So if your headaches are not getting better, they're getting worse, or you're worried, please definitely do reach out to your GP and take some advice. Hope that's useful. Have a great day.